sleep apnea is a disruptive and potentially dangerous sleep disorder. When we hear about it, though, we usually think of adults and not children with sleep apnea. Dr. Gugay from the Sleep Medicine Institute of Texas is joining us this morning. Thanks so much for being with us this morning.
Thank you, Dana. It's good to be here.
Well, let's talk a little bit about sleep apnea in children. How common is this really?
It's quite common, actually. We think that 1 in 5 or 6 children may be suffering from sleep apnea.
So what ages are we talking here? Are these as they get a little bit older or even younger children?
In fact, there is sleep apnea that is now considered as sleep apnea or sleep apnea of infancy. In their first year. There's a sleep apnea of prematurity that can occur when they're preterm births or babies that are premature. And then regular obstructive sleep apnea can occur in children as young as 12 to 16 months of age.
Oh, wow. So it's something a parent should think about early on. So what are some of the things that parents should be looking for as far as symptoms with their children?
The most important thing is family history, Dana. If there is a snorer in the family and your baby is mouth breathing when they sleep, that's a very common symptom of sleep apnea, what we consider as genetically determined sleep apnea. Of course, snoring is another symptom. Recurrent upper respiratory infections, asthma-like symptoms, because with sleep apnea they aspirate or suck acid up into their esophagus and that drips in their lungs, causing asthma-like symptoms. And then daytime symptoms of drowsiness, irritability, fatigue, hyperactivity, ADD, ADHD, headaches, sinus infections.
So how are these different than what you see in adults when they have sleep apnea?
Most adults with sleep apnea manifest with hypertension, obesity, diabetes, fatigue, sleepiness. Children develop hyperactivity more commonly than sleepiness. Excessive work or breathing causes these children to actually lose weight, so some of them could be low birth weight or low weight for their age. Others might actually gain weight, and most of the children are normal weight, even with sleep apnea.
Well, I actually had two children that were snoring, and it turned out to be their tonsils, but in the meantime, they did have some of this sleep apnea going on. What are some of the risks, though, that you should really take this snoring seriously in your children?
Snoring and sleep apnea can cause other sleep disorders, sleepwalking, sleep-related confusional arousals. Acid reflux, again, is one of the most common symptoms in children. Intellectual growth can be stunted as a consequence of sleep apnea. Physical growth can be stunted as a result of sleep apnea. So there are lots of serious long-term consequences to sleep apnea in children.
So how do we treat it? How do we fix all of these problems?
Well, the most important thing to do is get a clinical evaluation. So we can do a clinical evaluation, after which we decide if the child needs a sleep test to determine if they lose oxygen in their sleep and if it's disruptive to their sleep. If they have restless legs or periodic limb movements, those can also be diagnosed with a sleep test. And once confirmed, then we determine if it's the tonsils or adenoids that are causing the problem, get those taken out. Otherwise, they go on CPAP machines. Even
just
children
like
wear CPAP machines. Yes, ma'am.
But it's helpful for them in the long run, because you don't want them to have significant problems later on.
If you can convert the child into a nose breather by using CPAP or surgical interventions, then they may tend to have normal physical growth and might outgrow sleep apnea in their adulthood.
All right, that is really wonderful information this morning, and I'm sure parents are very thankful for that. Thank you so much for being here with us this morning, Dr.
Thank
Gugay.
you very much, Dana.